Hello guys, welcome back to the channel. It's Unit-8 Part G. Postpartum hemorrhage, also known as PPH. It is nothing but the bleeding that is occurring in the women from the birth canal after the delivery, that is in postnatal period. If it is more than 500 ml in the vaginal normal delivery and if it is more than 1000 ml in the C-section, it is considered as PPH. And it has two types, the primary PPH and the secondary PPH. If the bleeding is occurring for next 24 hours, within 24 hours, if the bleeding starts to reduce also, it is primary PPH. If the bleeding has been around 6 weeks, it is known as secondary PPH. Causes of PPH: uterine atomy. It is the failing of the uterus to contract and relax. If the uterus is not contracting and relaxing, we will provide more oxytocin and there will be excessive contraction. Because of that, PPH might occur. And then retained placenta. Retained placenta is even after removing the placenta, there will be few part of placenta still remaining in the uterus itself. Next, failing to progress during second stage of labor. That is, first stage will be occurring successfully, but second stage, the birth of the baby is still not taking place. At that time, we will provide oxytocin and there will be excessive contraction that may lead to PPH. Placenta accreta, it is the failure of separation of placenta from the uterus. From the uterus, the placenta will get separated by itself after the delivery of the baby. But at some condition, it might not get separated and that failing is known as placenta accreta. Laceration is the injury and the scars, that is laceration. Instrumental delivery, if there is any obstruction or the baby's head is too large, at some conditions we will perform forceps delivery, that is the instrumental delivery. If the baby is very large in size, that condition also PPH will occur. If mother has any underlying disease conditions like hypertension, diabetes mellitus, preeclampsia, these conditions can also lead to PPH. To remember all this, we can actually classify them into these 4 T's: tone, tissue, trauma, thrombosis. Tone is the movement of the uterus. Based on that, we can classify. I'll say it properly. Tissue is related to membrane and tissue. Trauma is the scar, the physical injury. The injury is known as trauma. And thrombosis is the clotting. When there is excessive bleeding, there will be clotting occurring. That is thrombosis. Okay. Based on the tone, if you see here, uterine atony is based on the tone. There is no proper movement. And failure of progress during second stage of labor, it is also based on the tone. There is no proper movement. That is related to tone. This tone can be even further classified as if there is multiple babies, then like multiple pregnancy, then there will be no proper movement. If there is a polyhydramnios, lack of amniotic fluid can also affect the movement. This comes under tone. When it comes to tissue, it relates to the placenta. Placenta accreta, retained placenta, placenta previa, placenta abrachia, cord prolapse. This all comes under tissues. When it comes to trauma, trauma is forceps delivery, episiotomy will be performed. This instrumental delivery, large size, if the baby is very large size, then instrumental will be performed. Laceration, this comes under trauma. Thrombosis, after every process there will be excessive blood going on, hemorrhage will be seen, blood clot will be seen, that is thrombosis. This is the cause of PPH. PPH can lead to a condition known as hemorrhagic shock, and this condition can actually lead to death. That severe this condition is. Hemorrhagic shock is nothing but an hypovolemic shock. It is caused due to the lack of blood flow, lack of oxygen supply in the body. It leads to hemorrhagic shock. When we cure PPH, then automatically hemorrhagic shock also gets cured. So based on the degree, we can classify the shock. If the blood loss is from around 500 to 1000 ml, it is normal, no need to worry, there is no shock here. While if it is more than 1000 ml, then automatically it is classified into 3 types. If it is 1000 to 1500 ml blood is lost, then it's a mild one, and at this condition the BP starts to fall. If it is 1500 to 2000 ml blood loss is occurred, then at this condition BP will be around 70 to 80 mmHg, and this is a moderate condition of shock. While if it is more than 2000 ml of blood is lost and it's very severe condition, patient will not able to move from his place and he will not able to talk or consume food. If for everything he will struggle and it is the severe condition. These are the degrees of hemorrhagic shock. Management of PPH. First, we will inspect the area, the reproductive system, to make sure how deep the injury is. Either suture is enough or we need to provide some special care. Sometimes the wound or the injury will be very small, but there will be heavy excessive blood loss. So first we will inspect and then we will provide the treatment. To protect a woman from the shock, we will provide IV fluids. Mainly blood will be provided. Blood transfusion will be done as soon as, and oxygen level will be maintained, and mainly these two, the vital signs, that is BP and urine output, this both will be maintained normally. If there is any fluctuation, we will inform the doctor and will provide medication for the difference. As shock is getting very deeper, the BP will be reducing, and as equally the urine output also will be reduced. So we need to maintain it. Management of PPH is actually divided into steps. The first is assessment, laboratory examination. Blood and urine examination will be performed. In blood, cognitive timing and blood group will be seen. In urine examination, color and volume will be seen. To avoid the shock, IV fluids, oxygen administration will be done, and regularly vital signs and urine output will be monitored. And inspection of the uterus will be done, mainly how deep the wound it is, either it is healing or not, and any previous history of trauma, that is any previous surgery, C-section, previous C-section, any clotting is present or not, we will inspect. This is step 1. Step 2, based on the condition, the therapy will be performed. Like if it is based on the tone is the reason for the PPH, then massage, compression, drugs will be provided. If tissue that is related to placenta, then the removal will be done and then the treatment will be performed. If trauma it is, then we will find out what kind of trauma it is, how deep, and how to repair it. If thrombin it is a problem, then we will provide anticoagulative drugs. If treatment doesn't work, we'll go with surgical method. In surgical method, we will try to repair the laceration, the injuries. If that's not possible, we will remove the part. Either any in which part the injury is seen, that part will be removed. Hysterectomy will be performed. This is the management of PPH in combined with shock. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.